President Darling and the faculty and staff at Lake Region State College, welcome to this important event. I am Lloyd Halverson, the self-imposed scheduler and minute taker for the COVID Appropriate Community Coalition. This coalition was born out of a community leadership meeting held just over 3 weeks ago to discuss how we could come together, not as doctors, group of boards, institutions, and businesses, but as a group of caring citizens intent on helping our community achieve a common goal. A special thank you to Devils Lake High School for allowing Laura Przinski and her students to broadcast this event, and to her student reporters for being present here today. Another special thank you to 1987 Devils Lake High School graduate Dr. David Burt, an emergency room physician by trade, for his tireless efforts behind the scenes helping us create quality initiatives that are vital to the coalition's work. Our COVID Appropriate Community Coalition members present today include Devils Lake City Administrator Terry Johnston, CHI St. Alexius Devils Lake Hospital President Andrew Lankowitz, Altru Clinic Manager Amber Stokey, and the Vice President of the Ramsey County Commission, Jeff Frith. There are others here as well who will answer questions at the conclusion of the prepared remarks. Dr. Doug Darling, President of Lake Region State College, Alan McKay, Administrator of the Lake Region District Health Unit, Dr. Stephanie Foudy from Altru Clinic, and Mr. Ryan Hansen, Principal at Devils Lake High School. With that, I will turn it over to Terry Johnston, City Administrator with the City of Devils Lake. Thank you, Terry.
Thanks, Lloyd. I'm sitting in for the mayor, so I'll just make a few remarks on what the city has done and what we're asking people to do. Last spring, we shut down our offices just like everybody else, and some businesses were closed, and we've been watching the numbers and hoping that things would slow down. And unfortunately, in the last couple of months, everybody knows it's gotten pretty bad. So at our, I believe it was October 26th special meeting, we passed a mask mandate. And we're asking everybody to, we're actually imploring everybody to follow that. We want the businesses to stay open. We want the kids to stay in school. We want them to participate in sports. We don't want to overrun our health facilities. So we're just asking everybody to follow that mandate as much as possible. I know it's a little bit of an inconvenience, but it's not too much to ask for our safety. Our city commission as a whole is a pretty conservative group, and I think I could safely say they believe strongly in individual rights. So it was a tough conversation for them to decide to do this, but in the end, it's just that serious of a situation where something had to be done. So I think that's why they voted to pass the mandate, and we're just hoping that everybody will follow that. I can see around town that it has gotten better, but I know we can still do better. So if you're out and about and you're with somebody that doesn't have a mask, please ask them to wear one. If you have the courage, ask somebody else that doesn't have one to wear one. But we just need to all do this together.
And next up we have CHI St. Alexius Hospital President Andrew Lankowitz.
Good afternoon. The hospital system in the Dakotas and the region is nearing capacity. This morning I sent a letter to the North Dakota Department of Health asking to increase our bed size to 35 beds from 25 beds. We have enough space in the hospital, but we don't have enough staff. I'm asking you, I'm pleading with you to wear a mask and socially isolate. If we do not bend this curve and it continues to increase, we will not be able to care for everybody that comes to our doors. There are many people that we would have to transfer out, and we're finding difficulty in finding places to beds in other hospitals where they could be cared for. The easiest way to protect you and the ones you love is to wear a mask and socially isolate. Please help us to help you.
And next we have Altru Clinic Manager Amber Stokey.
Good afternoon. The general state of healthcare at this time, we are seeing increased numbers throughout our community and surrounding communities, affecting patients in different ways and affecting all ages. Clinics and hospitals are overwhelmed with calls, patients, and that end is not in sight. Nursing homes throughout the state and in our community are seeing great increases in positive cases in staff and residents, leaving them concerned for the care of our loved ones. North Dakota hospitals are reaching max capacity to care for all patient types by putting us at great risk for the inability to care for those who need when the condition arises. What we can do as a community is avoid transmissible moments. Wear your mask. Masks are proven to work in preventing transmission of the wearer and those around them. Avoid large gatherings. Keep your social circles small. Be thoughtful of your holiday plans. Stay home with your immediate family. Create FaceTime meals with other family members in other areas. Create Zoom meetings. Bring together everyone virtually this holiday season. With these uncertainties and changes in our current healthcare situations, we must still remember that we need to schedule our physicals, schedule our mammograms, fill our prescriptions, take care of ourselves. Don't delay your care. Keep yourselves and your family healthy. Be patient with the medical community as we are navigating our way through this pandemic in real time, just as you are doing, and providing the best and safest way to effectively care for everyone. In-clinic appointments here in Devils Lake are available 8 to 5 Monday through Friday. Virtual express video visit options are available 7 a.m. till 10 p.m. 7 days a week through our Altru Health system. Thank you.
In school and continuing their education in person, keep our businesses open. One of the first things that I was asked are the words mandate, restrictions, limitations. When that is mentioned, well, what's the penalty? Well, the penalty isn't a criminal one. It isn't a monetary one to that individual. But what the penalty is it's a shutdown of schools. It's businesses closed, healthcare systems overloaded, and that is a penalty no government, community, or individual wants. A COVID-appropriate business practice is something that the coalition has come up with, and along with the help of Dr. David Burt, and David's been a great help to me.
Can I break in for a second?
Yep.
I'm learning that the audio is gone from Laura's on the radio and on Facebook.
Okay, I had to, it froze, so I had to stop it and restart it. So there's a new video.
Oh, and I was on such a roll too.
No, I got most of you.
Do you know when you lost it?
About right into the beginning of Jeff's.
Jeff, start again.
Yeah, start again,
Yep,
from the beginning.
it's back now.
Okay.
It's back, yeah.
Thank you, sorry.
That's all right. All the way from the beginning, or?
Yeah, let's do it.
Okay. I want to thank coalition members, Dr. Darling and Lake Region State for hosting today's meeting, and certainly Mr. Halverson for our organization of this. Very worthwhile and important discussion we're having. Today I'm here as a member of the Ramsey County Commission, but also as a very concerned citizen. I applaud the efforts of the Community Coalition and their organization, their collaboration, their dissemination of information, and their genuine concern for our community. On the 17th of March of this past year, Ramsey County Commission, in response to the global COVID-19 pandemic, took similar actions as federal, state, and other local entities were taking and declared a state of health emergency. And since that date, the county has taken various actions, passed various guidelines in hopes to keep our employees, our citizens safe from the dangers that COVID presents, all while maintaining the continuity of government services that are so needed. Our latest actions was in support of the City of Devils Lake and their mask mandate, as we passed our own resolution supporting the mask usage and to mitigate the migration of COVID-19 in all of Ramsey County.
This action was taken and done so to protect the residents and visitors, keep students in school in their in-class educational needs, keep our businesses open. And one of the first things that I'm always asked when you mention the word mandate or limitations or restrictions, well, what's the penalty that goes along with that? Does it have any teeth to it? Well, there isn't a fine in particular for not wearing a mask. There isn't a law officer that's going to come down and knock down your door because you weren't wearing one today in your local business. But the penalty is shutdowns. It's shutdowns of schools. It's businesses closed. It's our healthcare facilities overloaded. And that is a penalty that no government, no community, and certainly no individual wants. And with this community coalition, we've come up with an idea of a community-appropriate business practice, a campaign that we'd like to start working with local area businesses on to make their business more COVID-appropriate and safe for their employees and their customers alike. The only way that we can do this and drive numbers down is do some really simple things. And we've come up with really some 5 simple steps of doing this. It's wearing one of these when out in public and you can't social distance. Really simple and easy to do. We ask that people do that. Obviously wash and sanitize your hands frequently. I carry one of these little bottles here. It's a little bottle of sanitizer. And keeping spaces ventilating your environment. You don't have to have a very expensive, high scientific filtration system, but a open window and a box fan works really well as well. You know, and I can hear everybody's dad in the back of their mind going, "Well, were you born in a barn? Shut that window. We're not trying to heat the outdoors." But it's a really simple way, an easy way to help reduce the spread of the environment, along with the other activities that we're recommending, but also avoiding some risks, avoiding, you know, if you're looking at traveling to far distances or hosting gatherings, may want to rethink those type of activities. And then finally is having patience. This virus isn't going to go away anytime soon, unfortunately. But if we do these small little gestures and if we all work together, I think it's something that we can combat, and we can drive those numbers down and keep our communities open and our kids in school while protecting our teachers and the staff that so desperately required to operate a school. We can keep our health facilities open. And so when you do have a hangnail that you need help with or other medical emergency, that it's not full of COVID patients or other type of situations. We want to make sure that our communities stay open and viable for generations to come, and this is going to be a small step in the stepping stone kind of thing, and we need everybody's cooperation. By working together, we can combat this. With that, I'll stand down and open it up for the experts in the back behind me.
I think we have some questions that the student reporters in the back of the room have for our guests.
I am Viviana Kraft, a writer for the Lake Ripple Student Newspaper. This question is for Dr. Garland. It was reported yesterday in the Devils Lake Journal that Lake Region State College will be the site of an overflow hospital should CHI become overwhelmed. What planning has been done in that regard? Who will build it? Who will staff it? And how will it affect LRSC and their ability to continue delivering in-person classes?
5 questions. I'm hoping I can remember the 5th question when I answer the first one. But, last March, the state designated 10 different sites across the state where they would look at operating field hospitals. And the Army Corps of Engineers are the ones that are doing the planning for this, and they're a federal agency, and they would come in and construct the field hospital or the temporary facilities and operate them. But yesterday I did speak with the Governor's Chief Operating Officer, Tammy Miller, and asked, if they're looking at dusting off those plans that they made last March. And at this point, the challenge is not the space. And as our hospital director said, they've got the physical space, they don't have the staffing level to be able to take more patients. And they're seeing that across the state. So right now, they're not looking at setting up these temporary field hospitals. They're looking at how they can ramp up the staffing and utilize the space that they have available in regular medical facilities. We would have to have a significant change in conditions, and it would be only in an extreme emergency would they set up and run a field hospital here. But if that were to happen, we're ready, willing, and able to help the state and the local medical facilities in any way that we can. We do have space here to do that. And I think the last question you asked was, could we stay open and operating if that happened? And the answer to that is yes, absolutely, we could. We can deliver our courses and our programs synchronously at a distance. We wouldn't put them online, but we would use the technology to deliver them live, real-time to students at a distance. And we would still be able to utilize most of the facilities here on campus for our coursework. They were looking at utilizing the gymnasium and a few other areas for the temporary field hospitals. So first, yes, they've planned it. It's the Army Corps of Engineers that would set it up, operate it, and run it. We would just be the physical site. And right now, they're not looking at that because it's more of a staffing issue than a space issue. And yes, we would be able to continue to run our courses for our students. Did I get them all?
Yes.
Thank you. Great questions.
I'm a writer. I am Kayla Britz. I'm a writer for the Lake Ripple Student Newspaper. This question is for Mr. McKay. We're becoming aware that the delay in getting test results is getting longer and longer, with each testing event being held in Devils Lake. Many waited 5 or 6 days to get their results from last Thursday's testing. Does this impact your ability to issue timely quarantine and isolation notices? And is anything being done to shorten the turnaround time?
Yes, that is a very big problem we've run into. All of our tests that we've been doing for the last 3 weeks have been Mako tests, which go to North Carolina. So they don't get there as quickly as the state lab. And they have run into some problems of their own at that lab as well as the state lab. They are working to fix their problems there. Most of those have been IT problems. The state lab is overrun with the nursing home situation, some of which are now testing 2 to 3 times a week to try and keep their employees that get sick away from the residents so that the high-risk people don't catch COVID. So that's what's being done. We are meeting with the state health department 2 times a week, and most of that conversation concerns the testing time. And if you have a person that's positive and they don't know it for 5 to 7 days, think of all the people you come in contact with in that time. And so it just increases the spread immensely, and we've got to cut that time down. If we don't, it'll continue to rise. So that's where we're at right now.
Well, this question is for Dr. Foudy. There is a lot of talk on cable news and guidance coming out of the CDC and NIH about eliminating Thanksgiving. I thought we were supposed to avoid large gatherings like crowded dance floors, concerts, and sporting events. Are family gatherings a concerning source of spread? What should we do and what should we not be doing for Thanksgiving to keep ourselves and our families safe?
So that's a very good question. I think on the media, we hear a lot of things about super spreader events, these large events where numerous people get sick. However, as we're looking at the numbers, both in North Dakota and throughout the country, what we're finding is a lot of the events where people are getting sick are actually smaller gatherings, large family dinners, game nights, gatherings, especially of younger individuals. And so really, I would never encourage anybody to cancel Thanksgiving. I think that's a strong, too strong a word. As Amber Stokey mentioned earlier, there's a lot of ways that we can still celebrate Thanksgiving, but do it at a distance. So recommendations would be to celebrate Thanksgiving only with those in your immediate household, or if you have a very minimally extended bubble. What do I mean by that? If you are a family with children, and say you have an aunt or a set of grandparents that are watching your kids frequently and you are frequently in contact, those people would be fine to have at your dinner table in your Thanksgiving celebration. Otherwise, really, we should be trying to find ways, unique in different ways. It's a great time to come up with some different ideas. Maybe you make dinner for relatives and bring it over. Maybe you guys sit down and share some recipes and sit down over Zoom or FaceTime or Skype and talk about how you think they turned out. If you really do think you must see your family on Thanksgiving, I would recommend that you eat separately and that you sit socially distanced with masks on at all times. So this could be outdoors if it's nice enough, indoors if you have a big enough space, but really focusing on that 6 feet apart from anyone who's not in your home and having everybody wear masks. I understand it's the holidays and it's a really hard time to be separated from our families. I feel the same way. However, as everybody here has mentioned, we are really nearing a really critical point, both in our community and in our state, where if we don't make some changes, we are going to start seeing a lot more sick people, and not just people with COVID, people who have other medical conditions and won't be able to be cared for locally or maybe even in the state. It's really easy to focus on COVID, but the reality is people are still going to have heart attacks. We're still going to have car accidents. And so while I understand that these changes are difficult, they're not pleasant, they put a strain on us emotionally. They really are important so that we can hopefully in 2021 be having our typical Thanksgiving and Christmas gatherings.
This question is for Mr. Hansen. What are the schools doing to mitigate or track cases within the schools and/or activities?
So I can't talk about all the mitigation that we tried to do, it would be too long, but we do have a committee that meets on a weekly basis for the Devils Lake Public Schools Health and Safety. That includes an entire document for the public schools and then another document for all of our activities. Our coaches do a check-in, kind of a health check with every student athlete or participant if it's an activity that's not a sport, prior to a practice, an open gym, a game, whatever it might be. We are asking our student athletes to stay home if they are ill. That's probably the biggest thing I can say over and over and over is if you are feeling ill at all, that is the time to stay home because you missing one practice might keep the rest of the team active. We've had some cases this year where a student athlete showed up that was not necessarily feeling the best and knew it, and then a day or two later tested positive. That shuts down the entire activity. I tell the kids that the blood, sweat, tears, and spit travel everywhere on the playing surface, the rink, whatever that might be. So if you are there as part of that activity, you're going to be shut down as a close contact for our school system. We have hand sanitizer basically in every classroom and probably every 50 to 100 feet in our hallways right now. Grades 5 through 12, we've been on a hybrid model throughout this school year. So when we have half the kids in the building each day, this has really helped us isolate, socially distance, and really remove most of the close contact expectations that you would assume would happen in a school. We've really been in contact with the local and state health departments in tracking close contacts and helping identify those kids as soon as possible and those staff members as soon as possible. We've been on the phone at night, on weekends, whenever necessary to alert people that they are a close contact and they need to quarantine. We've eliminated, as many have probably noticed, fans from all of our contests so far this year. We've also eliminated any outside entities using our building, like the Class B events. You're gonna notice no regional tournaments, no Ramsey County, no Lake Region basketball tournaments, things like that. Our parent booster meetings are online. Our staff and professional development has virtually been online. Basically, we've done everything we can to limit access to our buildings. And right now, the entire EDC has a no fan policy, so there's not a school in the EDC allowing anybody at their contest. So we're doing our part to try to stream as many of those activities as possible. Again, for us, the biggest things I would say is make sure you're wearing your mask. If you're not feeling good, please stay home and do all of those sanitary type things that you can to keep yourself and your family safe. I just want to end by saying I greatly appreciate the support that our schools have received from the students, the staff, the parents, the community. It's been an outpouring of support to keep us moving forward and to keep our kids in school, and we greatly appreciate that. And hopefully at this point, everybody understands the importance of being safe and following the guidelines that are set forth so that we can continue moving forward and hopefully see a downward trend in the current health status of our community.
This question is for Dr. Darling. There has been a lot of speculation about whether there will be a way to have in-person / on-campus learning this winter, and whether or not your athletic teams will be able to compete. What needs to be done to make sure students are able to learn in person and compete in their activities?
Well, first and foremost, Lake State College has a real strong desire to afford students the opportunity to participate in both curricular and extracurricular activities. And our students spoke loud and clear this fall when they came back. They want to be here in person. They experienced the last half of the school year last year doing things online at a distance, and they didn't care for that. And I can't say that I blame them. So we're going to be working hard, and our students have worked hard this fall. They've done everything we've asked them in terms of socially distancing in the classroom, following the sanitary guidelines, not congregating in groups on campus, and we've been able to keep the number of positive cases on campus at a minimum. And that's allowed us to stay face-to-face. We plan on doing the same things for January. We plan on being open face-to-face. Many of our programs, our career and technical education programs, where you can't do some of the labs and skills things at a distance or in an online environment. Nursing, for example, needs to be able to do their clinicals. Our wind energy technician program, those students need to be able to get up in the turbine and actually work on it to complete the skills necessary to graduate. So we also think or believe in that our students that participate in the other activities, drama, DECA, VICA, the co-curricular activities are extremely important in developing our students, both for the skills in their professional program area as well as in their leadership skills. So I know that the members of the coalition want us to be delivering classes here on campus face-to-face, and the students have spoken loud and clear, and they've done everything we've asked them to this fall to ensure that they could continue to do face-to-face classes. So we need everybody to continue to do those things for spring semester, but we need the help of the community. We need the community to mask up, follow the social distancing guidelines, not have large gatherings off campus, and we can remain open and remain face-to-face. I'm confident that this community, this region, and our state, if we work together, we can bend the curve of this virus and this pandemic down and keep open and operating, and I think that's vital for our whole community and for the state. this is a preventable disease, and if we choose to do what we need to do to prevent it, it can be done. And I'm confident that the people in this part of, in Devils Lake and in this region of the state will do what needs to be done to make sure that happens.
And this next question I have is first for Mr. McKay and then Dr. Foudy. Could you help our audience understand the lag time for actions we take now to see the benefit later? For example, it's been almost 3 weeks since we put in a mask mandate in the city, and we're not seeing much yet in terms of results. Our numbers are still rising at what appears to be the same rate. And I'm wondering, are we not getting enough compliance? Or is it just too early to see the results?
Well, there's a lot of factors there. One is not everybody is masking up. The other is there's still a lot of people meeting in large groups, whether it's a party, whether it's a family get-together. And we keep telling people, if you isolate now, it will shorten this in the long run and give us less people that are turning positive. Basically, we test as many as we can each week. We're up to 326 here this last Thursday. The lag in getting the test results is really hurting us. We need to get that information to those positive people as soon as we possibly can, and we are working on that with both the state health department and the labs themselves. But we plan on keep testing. We are also currently planning to deliver COVID vaccine to the public. This will all take place as soon as they get a vaccine out that has been tested thoroughly enough that it has minimum side effects. So right now the plan is to start with healthcare workers. So we will see as soon as they approve a vaccine, they will be sending it out to the hospitals, to the clinics, to public health to do immunizations of people for COVID.
Excellent, thank you. Dr. Foudy, did you have any remarks regarding the lag time or any of that?
Yeah, I can. So Mr. McKay addressed most of this. The mask mandate has been in effect for about 3 weeks. Generally, we need a good 2 weeks to see any improvement. However, most of the studies out there say we need 70 to 80% compliance in order to see an improvement from a mask mandate. Now, there are a handful of different things where people may not be able to wear a mask. And so that's why it's important for anybody who can to make sure that they are. So that those individuals who have a medical condition and maybe cannot wear a mask, they automatically are going to make our numbers not 100%. And so it's super important that everybody who can wear a mask does. Just to kind of also touch on what Mr. McKay said was the lag time. We're in a little bit different situation at the clinic because most of the people that we are testing either have an exposure or have symptoms. It is so important that you stay home until you get your test back. I know it's hard when you're missing work for 5 to 7 days, but if you go to work and you expose and you happen to be positive and you expose your coworkers, now you've also put them on quarantine for even longer time periods. So I understand it's frustrating. We get a lot of calls every day asking when the results are back, and we have no control over that. So we are frustrated as well. Just please have patience with us and please stay home while you're waiting for your results.
And this final question that I have is for anybody that wants to take a stab at it. But last night, the Grand Forks mayor issued an executive order creating some pretty significant restrictions on bars and restaurants that serve alcohol, closing them early, closing down their dartboards and their pool tables, requiring sitting room only without standing in groups, mask requirements when you get up to go to the bathroom or when you come to and from the entry door. How does this coalition engage our community not just bars and restaurants, but the greater Lake Region business community on adopting COVID-appropriate business practices? Anybody?
Well, I'll take a shot at this, sure. I guess what I would say is that our students can do it. They've proven it. I can only speak for my building very specifically, but kids in grades 9 through 12 in Devil's Lake have complied from day one. I seldom have to say, where's your mask, or pull your mask up. Kids enter the building without a mask and look at me and say, I'm going to the office, I forgot my mask, I'm sorry. I don't have to say a word, they're taking care of it. They remind each other in the hall when they forget their mask. They eat lunch alone. Think about that, people. Our kids are sitting alone at a desk to eat their lunch and their breakfast. There's absolutely no social gathering going on. In classrooms, for the past 5 to 7 years, everything in education has been about collaboration, group work, team projects, all of these things, and now we're telling kids stay away from each other. They are still finding ways to collaborate and work together through distance learning, through Snapchat, text messaging, Instagram, whatever they may use. Kids find ways to adapt and cope. And I guess my message would be, if the children can do it, maybe it's time for the adults to figure it out.
And I would offer up that if we work as a team, if we work as a coalition, and we engage all of the different segments of our community, and we encourage them to adopt the safe practices, if our kids can wear masks all day in school, if our kids can wear masks all day at college, if we can create a learning environment here at the high school where we don't have any close contacts, where our students are sufficiently distanced, where they're wearing masks and they're being safe, then the adults in our community could do the same. And I think they would embrace that when presented with logical and reasonable alternatives to maybe the current social environment. So with that, I would say that this coalition will resolve to work in that and work with the chamber, Paula and Susie, and roll out some of those initiatives, some of those informational sessions, put some COVID safe practice packets together, and start going around and encouraging business owners and managers and employees to become ambassadors for a program like that. Andrew, did you have a comment?
It's pretty hard to top what Mr. Hansen said, but the Community Coalition has gotten together to offer chamber bucks. So as you're around in the community and you go to a business, someone might see you wearing a mask and present you some chamber bucks. I think the City Commission was very wise not to put in a punitive mandate. We need to be kind to each other and we need to help each other out. If you see someone that needs help, kindly ask them. And if you need help, ask for assistance. So I think we're trying to be very positive about this and supporting each other, and we can get through this. So please wear a mask and please social distance as much as you can.
We've had, Lake Region District Health Unit has had several
Just wait,
businesses
Alan.
call us.
Let's wait for the microphone.
Okay.
We have several more on order. Freddie was up today when I realized we only had one.
Yeah, Lake Region District Health Unit has had several calls from businesses inquiring what they can do to help during this time. And of course, with the mask mandate, we've explained that, and social distancing, and several businesses were calling us before that mandate, and we're on board to help out and have signs on the front of their businesses so that when people can please wear masks. And if everyone would wear a mask, I think we would start seeing the decline here, in 2-3 weeks. It takes time for that, and I think it's the least we can do to help each other out.
Excellent, thank you, Alan. Dr. Garland?
Well, I think our business community can step up and not put the mayor or the city commission or the county commission in a position to make those rules. I think they can step up and put in COVID-safe practices that work for their business. I mean, each business owner knows their business, knows their customers, and can put in some COVID-safe practices that I think will be, that can be effective, including mask wearing and distancing and not having large groups gather. So, you know, we did that back in July here at Lake Region State College, and we've seen it works. And our students have stepped up and done it, and our faculty and staff have done it. So I think that the business people and the customers themselves can help our businesses. And, you know, I plan on patronizing businesses that are providing a COVID-safe environment. And so if they're not, I'm not going to go in there. And I think we can vote with our feet and vote with our dollars and help out those businesses that are trying to help out the community by being COVID-safe.
Excellent, thank you, Dr. Darling. Any closing comments from any of our guests here today, or any additional questions from our student reporters? Okay, hearing none, that concludes our event for today. Thanks to all of our guests for taking time out of their busy day to help educate our community. And thank you, Laura, for streaming this. And thank you to our reporters in the back again for asking those great questions.